Okay, welcome to the third video on chapter 14. Today we're going to talk about the cranial nerves. So, of course, the brain has to be able to communicate with the rest of the body. And so there are 12 pairs of cranial nerves that arise from the base of the brain that allow that brain to do that communication. They exit the cranium through the foramina, and they lead to muscles and sense organs located mainly in the head and the neck. So let's talk about the cranial nerves. Some cranial nerves are classified as motor nerves, some are classified as sensory, and others have mixed where they are both motor and sensory. So the sensory nerves are 1, 2, and 8. The motor nerves are 3, 4, 6, 11, and 13 and 12, and they stimulate muscle, but they also contain fibers of proprioception. And then mixed, they are 5, 7, 9, and 10. And the sensory functions could be quite unrelated to their motor functions. For example, the facial nerve, number 7, has sensory role in taste and a motor role in facial expression. Taste and your facial expression, they don't always go together. Sometimes they do, but they're unrelated to each other most of the time. So let's talk about each of them individually. So here is olfactory nerve number 1, and the olfactory nerve is a sensory nerve, and it transmits sensory information to your brain regarding the smell that you encounter. The nerve signals are then sent to areas of your brain concerned with memory and then recognition of those smells, right? If you sever this olfactory nerve, you will no longer smell anything. The optic nerve. The optic nerve is another sensory nerve, and it involves, obviously, vision. Light enters the eye and it comes into contact with these special receptors in the retina called the rods and the cones. And this information that's received by your rods and your cones is transmitted to the optic nerve. Both of your optic nerves, because there obviously are 2 of them, meet to form the optic chiasm where they cross. You can see that in the image right there. Nerve impulses arrive at the visual cortex, which processes the information. The visual cortex, of course, is located in the back part of your brain. Okay, number 3, the oculomotor nerve. This is a motor nerve. It has motor functions of muscle function and pupil response. The muscle function, it provides motor function to 4 of the 6 muscles around your eyes. These muscles help your eye move and focus on the different objects you're looking at. The pupil response also helps to control the size of your pupil as it responds to more or less light. Next, the trochlear nerve. The trochlear nerve controls your superior oblique muscle. This is the muscle that's responsible for downward, outward, and inward eye movement. So it's a different nerve than the last one we talked about. Number 5 is the trigeminal nerve. It's the largest of the cranial nerves, and it has both sensory and motor functions, and it has 3 divisions, which are the first, the ophthalmic, which sends sensory information from the upper part of your face, the forehead, the scalp, and the upper eyelids. The maxillary, which communicates sensory information from the middle part of your face, including your cheeks, your upper lip, and your nasal cavity. And the mandibular, which has sensory and a motor function. It sends sensory information from your ears, your lower lip, and your chin. And it also has the ability to control the movement of muscles within your jaw and your ear. And it also contains proprioceptors, okay? So let's move on. The abducens nerve, or number 6, works along with that oculomotor nerve 3 and the trochlear nerve 4, and it is also responsible for different movements of the eye, and it's purely a motor nerve, okay? The facial nerve provides both sensory and motor functions, including moving the muscles that are used for the facial expressions, as well as some muscles in your jaw, providing a sense of taste for the most of your tongue. That's obviously a very important nerve here. Supplying glands in your head or neck area, like the salivary glands and the tear-producing glands, and communicating sensations from the outer parts of your ear. Okay, here are the 5 branches of the facial nerve, and they start at the top there, the temporal, then they move down to the zygomatic, the buccal, the mandibular, and the cervical. And here you can see a good example of where those actually are. Since there's 5, you can use the fingers of the hand to show where they lie. Okay, the vestibulocochlear nerve is a sensory nerve, and the functions here involve hearing and balance. And it consists of two parts: the cochlear portion, which has specialized cells that detect vibrations from the sound based on loudness and pitch, and this generates nerve impulses that are transmitted to the cochlear nerve, and the vestibular portion, which has specialized cells that can track both linear and rotational movements of your head, and this information gets transmitted to the vestibular nerve and is used to adjust your balance and equilibrium. All right, now let's talk about the glossopharyngeal nerve, number 9, which also has both sensory and motor functions, including sensory information from your sinuses, the back of your throat, parts of your inner ear, and the back part of your tongue, and it provides a sense of taste for the back part of your tongue. And it also has a motor function on stimulating the voluntary movement of a muscle in the back of your throat called the stylopharyngeus. Okay. The vagus nerve is the most extensive distribution of any cranial nerve. It has a major role in the control of cardiac, pulmonary, digestive, and urinary functions, swallowing, speech, regulation of viscera, and damage actually causes hoarseness or loss of voice, impaired swallowing, and it can be fatal if both of these are cut. The vagus nerve is number 10. It has both sensory and motor functions, including communicating sensation from the ear and throat, sensory information from the organs in your chest and the trunk, like heart and intestines, allowing motor control of muscles in your throat, stimulating the muscles of organs that move food through your digestive tract, peristalsis is what that's called, providing a sense of taste near the root of your tongue, and it's the longest nerve, and it extends all the way from your head into your abdomen. Okay, the accessory nerve, number 11. It's a motor nerve that controls the muscles in your neck, allowing you to rotate, flex, extend your neck and shoulders, divided into two parts, spinal and cranial. The spinal portion originates in the upper part of your spinal cord. The cranial part starts in your medulla oblongata. These parts meet briefly before the spinal part of the nerve moves to supply the muscles of your neck, while the cranial part follows the vagus nerve. Okay, number 12, the hypoglossal nerve. This provides movements of speech, food manipulation, and swallowing in the tongue. Okay, let's finish this up and talk about homeostatic imbalances of the brain. So cerebrovascular accidents, or CVAs, like stroke or transient ischemic attacks, which are also called mini strokes. So a stroke is the third leading cause of death in the United States. Ischemia anemia is caused by reduced or blocked blood flow to the brain. Hemorrhages and blood clots increase the intracranial pressure. The brain tissue dies, and risk factors that can include your risk of a stroke are high blood pressure, high cholesterol, heart disease, narrowed carotid arteries, diabetes, smoking, obesity, and excessive alcohol intake. Mini strokes could last minutes, where the flow is reduced and the brain tissue suffers temporarily until the blood flow is reestablished. Meningitis is inflammation of the meninges, and this is a serious disease of infancy and childhood between 3 months and 2 years of age. It's a bacterial and a viral invasion of the central nervous system by way of the nose and throat. The pia mater and the arachnoid mater are the most likely to be affected. Signs include high fever, stiff neck, drowsiness, an intense headache, and may progress to a coma and death. This is diagnosed by examining the cerebral spinal fluid. Cerebral palsy is damage to motor areas of the brain during fetal life, at birth, or during infancy. Usually there is oxygen deprivation that's occurring here. And what it gets is poor control and coordination of voluntary muscle activities, but there's usually little impact on intellect. It's irreversible but not progressive. Now, about 70% of the victims do appear to have an intellectual disability, because that's often due to their inability to hear or speak well, but generally they are more aware and understanding of their situation and surroundings than they appear. So basically cerebral palsy does not on its own affect a person's intelligence, but as many as 30 to 50% of the children that have cerebral palsy will also have some form of cognitive impairment caused by a coexisting condition. Hydrocephalus is a buildup of fluid inside the skull that leads to brain swelling. Hydrocephalus means water on the brain. The flow of the cerebral spinal fluid could be blocked. There could be too much of it. This could happen from trauma or infection. It leads to cognitive difficulties, but if it's treated early, the damage could be minimized. Epilepsy. Epilepsy is a brain disorder in which a person has repeated seizures over time. Seizures are episodes of distributed brain activity that cause changes in attention or behavior. This can be caused by any damage that changes the electrical conduction through the brain, like a stroke or a TIA, dementia like Alzheimer's, traumatic brain injury, infections, brain problems that are present at birth, brain injury, metabolism disorders, brain tumors, abnormal blood vessels, other illnesses that damage or destroy brain tissue, and the use of certain medications like antidepressants, tramadol, cocaine, and amphetamines. Alzheimer's disease. About 11% of the population over age 65, which is 4 million people, suffer from this, and 100,000 die annually. There is also a hereditary component. This causes widespread cognitive defects of short-term memory, loss, shortened attention span, and disorientation, and loss of language skills. There often is death from secondary causes like being bedridden. The diagnosis is really difficult since there's really no definitive test, and only after death can it be confirmed by autopsy. What happens is you get significant loss of neurons in specific regions, and these abnormal proteins are deposited in the brain tissue, and you get tangled nerve masses, and it's really horrible. Generally, this damage is limited to the cerebral cortex, but a lot of important stuff happens there. Parkinson's disease, when the neurons in the substantia nigra are damaged in large numbers, you get a loss of dopamine. And that prevents normal function of the basal ganglia, and it causes the motor symptoms of Parkinson's disease, like tremors, rigidity, impaired balance, and loss of spontaneous movement. And so with that being said, you've reached the end of chapter 14.